One of the most common complaints that I get for people performing the Copenhagen Plank or any of the variations is that they get inside or medial knee pain. Could be from an MCL injury, a meniscus injury, or various different types of knee pain issues. And so they blame the exercise as opposed to trying to find a way to build their capacity up to being able to perform the exercise in a progressive way, shape, and form. So now certainly there are some people who should not be performing this exercise just because of past medical history and issues like that, but I would argue there's a lot more people who are capable of performing the Copenhagen Plank to some degree who just avoid it because they don't know how to go about the exercise step-by-step manner that builds capacity of the tissue back up again. So what we're showing here, first and foremost, is the easiest point of entry is flipping the Copenhagen Plank around and elevating your elbow up on a surface. The higher you elevate that elbow, the easier it is going to be on your leg to support yourself. Now, you can also put 2 feet on the ground versus just 1 foot on the ground. This will impact the amount of load going to the medial knee. So start at a load that you feel comfortable and you can hold for at minimum 10 seconds, upward of 30-45 seconds, and then you progress the level of the exercise to 1 foot. And when we do it on 1 foot, note that we keep the foot flat on the ground. We don't dive the foot inward where we're just operating on the inside aspect of the heel just yet, because this places a lot more stress on the medial knee structures. This is also why if you perform a lateral lunge, you'll see people perform it where their foot comes off the ground and then they complain about medial knee pain in their trail leg. This is why, because they're putting a lot more stress on the inside aspect of the knee. They think they're doing themselves a favor by being able to drop lower on the working leg, but it causes pain on the non-working leg, the leg that is experiencing the stretch and the load through that stretch. So in both instances, I would encourage you to keep that foot flat on the ground. Plus, if we're talking about sport and injuries, teaching someone to plant through their whole foot is a lot better than teaching someone to plant through just the inside aspect of their foot. So when we're up on our feet, functional, I would encourage you to plant through the whole foot. Then once you can start tolerating more loads to the inside aspect of the knee, then we can start going to more of the true Copenhagen Plank variation. Now it may be useful for you to start at the knee, but then eventually we want to start working our way out away from the bench and creating a longer and longer lever arm. But you don't have to necessarily go straight to the foot. You can go to the mid-shin, and that's a way of adjusting the load by adjusting the lever arm. Now, similar to when we were standing with our feet on the ground, we can also put 2 feet on the bench to reduce the amount of load going through the leg. So now we're about 50-50. This will feel more natural or more loading of the down leg through the adductor if you put the leg behind you on the bench. So note where the foot placement is. It's the back foot that you are loading if you're doing 2 feet on the bench. To progress this further, now we can, instead of increasing the lever arm, we can increase the load in this position. So we can add weight to either the 2 feet on the bench or the shortened lever arm on the bench. And then finally, we can work our way out to the heel, where we have that full lever arm, but we're going to reduce the load back to body weight, and then we'd build up weight and load over time. And then once you can do it statically with load, then you can do it dynamically, pulsing up and down with no weight. You may even choose to shorten that lever arm again, where you don't go strictly out to the foot. Maybe you go to the mid-shin again, and then you work your way out to that longer lever arm position over time again. So the dynamic version, you could go through the same progressions where you have 2 feet on the box or shorten that lever arm, no weight, and then work on increasing that lever arm and adding weight over time too. So there's various different entry points depending on your capability, which is why there's far more people who are capable of achieving Copenhagen planks again, even if they've had any type of medial knee pain, meniscus pain, MCL pain. You're still capable of performing this if you go through the correct progressions. Now keep in mind, I don't know your given scenario, so it would be good to discuss your current situation with somebody to make sure that this is a safe progression for you. Because again, there are some people where maybe this isn't the best idea. But the point of the video is that there are far more people who can, when going through the correct progressions, as opposed to people who cannot or should avoid the exercise.